All right, so we're going to go ahead and get started. Thank you everyone for joining tonight's webinar. You are in the right place. It may not look like we're on campus because we are not right now, but you are in the right place. We're from Divine Mercy University, located in Sterling, Virginia, which is right outside of Dulles Airport. And this will be an overview of the Doctor of Psychology and Clinical Psychology program, which is often referred to as the Psy.D program.
Perfect.
I'm excited to be here with Tammy Spix-Kill-Hefner. She's the Associate Vice President of Admissions and the Psy.D program representative. And you've actually been here a number of years, haven't you, Tammy?
Yeah, I've been at IPS and DMU now. I believe it's about 7.5 years. So I'm putting some good time in. So it's given me it's actually given me a great background just to be able to learn about the university as we've grown. And we'll talk a little bit about that here tonight. So I'm really fortunate to know a number of graduates now that I've actually helped with, recruiting and bringing them into the program for their dream of clinical psychology. And I actually found out about Divine Mercy University and when it was the Institute for the Psychological Sciences, when I was actually working at another institution as Associate Dean of Students. And I do like to share this, by the way, with potential students that I encountered the DMU and IPS the first time through sending students who needed therapy to a particular therapist in this area where we are in Virginia, not knowing the connection that this person was a graduate of this program. And we used a number of therapists at this institution, and I just saw like real progress in the students to this particular therapist. And I mentioned it to a couple of colleagues. I was like, what's different? And somebody, piped up and like, oh, have you heard of them? They went to IPS, they went to DMU, like it's a really great school. And I learned about the meta model. And so I knew about DMU just through kind of that experience, which was a great testimony for then actually by chance ending up one day working at DMU. So I feel very fortunate to be able to share that with you all here and having had that experience kind of firsthand, seeing the difference in the therapeutic model. So kind of fun to share that.
And that's a new story to me. There's so many stories of how we're all connected. And I'm Ebony Schamberger. I'm here in marketing and communications. So I'll be sending this follow-up recording via email, reminding you all of the application deadlines and assisting Tammy throughout today's webinar. So if you have any questions, we'll make sure that we get to them appropriately.
Awesome. Well, I'll go ahead and get us started. So here, we're just going to talk a little bit about the history and mission of the university, now Divine Mercy University. So we've been around for a little while, but yet at the same time, we're still young. We're about 20 years old right now. We were founded in 1999 as the Institute for the Psychological Sciences, and a lot of folks still do know us as IPS. We actually grew in 2014. We launched an online program in addition to the Psy.D program, an online MS in general psychology. That was kind of our next big growth move after the Psy.D program. And that program is quite different than the Psy.D program that you all are looking at. That's not a clinical degree, really more geared toward the helping professions, but it really built the university and kind of put us in a new direction toward growth. So we're really excited when we launched that program. And then in 2015, we actually renamed IPS and really, in a certain sense, rebuilt or built the university called Divine Mercy University. And what really triggered that change and that growth was the addition of the School of Counseling. So at Divine Mercy University, we actually have two schools. We have the School of Psychology, which again, some of you may know of as IPS, and then we also have a School of Counseling that does have a hybrid online counseling program, which we'll be discussing just to share with you in just a moment. So a little bit about our history and kind of how we kind of came to be.
Yeah, and I did want to note, so something that you probably wouldn't know about as we go throughout today's webinar is that we have pictures from graduation. So this is actually, the background is a picture of the Basilica in Washington, D.C., where our students graduated probably about 2 years ago. So just keep that in mind. This is actually the experience that you would have with walking across the stage there. So.
And I do want to share, actually, because that is kind of a big deal, that this year we did not have our graduation held in person, but we are actually excited to share that we do have graduation planned, and the shrine in DC, as Ebony mentioned, it is reserved. So we do look forward to hosting graduation this coming year, and hopefully all of you that would decide to come to the program, you know, for 2021, this would be, again, the location of your graduation. It's just a fun little fact to share, and it's really great honor to be in the Basilica for graduation.
Oh yeah.
Okay, I'm just going to continue forward. And by the way, if you have Ebony, we'll keep track of this for us and share. If you guys have questions, you can just put them in the chat, and at different times we'll pause for questions, and then we'll also kind of maybe get those weaved in as we're working through this presentation as well. So feel free to ask questions at any time. Even if we haven't covered material, or even if we did cover it, just pop your question in there. We'll make sure we get you guys an answer, okay? Just kind of continuing on with the presentation, I want to give you again that framework of what Divine Mercy University looks like. So as I mentioned just previously, we have two schools under the umbrella of Divine Mercy University: School of Counseling, Institute for the Psychological Sciences. This slide illustrates really well just that they are two separate schools. The School of Counseling has one program, the MS in Counseling. It's actually the Master's of Science in Clinical Mental Health Counseling. That's the name of that degree. And it is an online hybrid degree. So hybrid just means that there are going to be times that you actually have to be in person. So for example, the clinical training pieces are actually done in person. So that program does have some residencies where the online students gather in person for special training. Then looking at the Institute for the Psychological Sciences, our School of Psychology, this is the program that this is a school, excuse me, that your program that you're looking at tonight falls under. We have in that school, we have the Psy.D in clinical psychology. It is an APA accredited program. I'm really proud to share that with you all, just to make sure everybody here does know that we are APA accredited. That was the first program of the university, so that's really exciting to share that. And since then, as we've noted a moment ago, we did add MS in general psychology. That is a completely online program. Again, a non-clinical helping professions based degree. And again, that was born out of the realization that there are professionals out there who are maybe different from those of us here, where they don't want to be actual clinicians or therapists, but they still need a background in basic mental health triage for their work that they do, working with just folks in the helping resources fields. So a little bit about the university there for you guys. We have actually an incredibly rich vision and mission that you, it's probably one of the reasons that you're here tonight, actually. I do want to take a moment and just encourage all of you to you know, really challenge yourself to dig deep into that mission. Check out our website. Again, it's actually a really well thought out mission and vision. And what I wanted to do is just take a moment here and just grab a little snapshot of what that mission is for you as a prospective student. And at DMU, it is our hope that we provide our students with an effective academic and educational environment that supports the integration of the psychological sciences and the Catholic Christian understanding of the person. And further, we want to prepare our students to respond to their vocation as mental health professionals. So there's a couple of big things that are takeaways from this particular segment here. And that is the key piece for us at DMU that makes us very unique and truly unique. That's not just a tagline. We are really one of the only, I think we're the only program that obviously that I know that does this kind of integration, but we're one of the few Christian-based programs out there. But for us, it's really important that folks understand what we call integration. And integration is where we bring together good psychology, excellent psychology, that excellent psychological education with the Catholic Christian philosophy and theology of the person. So it's what we know to be true of what it means to be human. And that really does enhance and completely change the way we approach our clients and our work in psychology. And we do also view this as a professional vocation. You might have heard of, it's certainly a profession, but we take it a step further here, and we really believe this is a call or a vocation. So you might even see things we ask, do you have a vocation to heal? Do you have a vocation to serve? Because we really do believe it is an interior calling. So it's more than a job. So that's something, those are just a few of the takeaways here that are coming from our mission and vision at DMU. All right, now moving on here, we have accreditations and approvals. I think I remember a moment ago, I noted that our Psy.D program is APA accredited. So we're actually really excited to share that for the program itself, we do have APA accreditation, which is really, really important for you as a future psychologist to have an institution that does have that recognition and accreditation by APA. We did achieve that for the Psy.D program in 2016. And again, really fortunate. I think it's a real testament to the integrity and just the richness of our program that we, upon the first try to get APA accreditation, we got full accreditation. So we didn't get provisional accreditation. We got full 10-year accreditation for that, which is, again, a really, really big deal. Our faculty and our university are very, very proud of that. A lot of hard work went into making sure that we made that goal for ourselves. Prior to 2016, we did not have APA accreditation, and I want to just share a little bit about that. Part of that is because until recently, APA accreditation wasn't actually required in the profession of psychology, and the university over the last number of years has seen that more and more states are requiring APA accreditation for licensure. So we decided that it was, of course, in the best interest of our students to jump on board, making sure that our students had an education that had that accreditation so they really could be fully licensed anywhere that they go. So it was a really big deal for us. It's a really big deal for you as a prospective student to be aware of that. In addition to APA, which does, just to be clear, APA only accredits Psy.D programs, so it doesn't apply to like the whole university, it's just that program. That's how APA works. The university as a whole is accredited regionally. In the United States, there's not like a national accreditation, it's regional. And so here in our area, we have accreditation by SACS. That's the Southern Association of Colleges and Schools, specifically the Commission on Colleges. So we do have SACS accreditation. We are also recognized and have approval to operate in the state of Virginia as an Institute of Higher Education through SHEV. And that's that State Council of Higher Education for Virginia seal that you see there. And then kind of also moving back to the psychology side, we do have the ASPPB recognition, so the Association of State and Provincial Psychology Boards. So we have their recognition as well. Again, another important organization here. So what that really just means for you guys as prospective students is that university does have the correct and sufficient endorsements and operating permissions and accreditation for you to have full privilege once you are a graduate and looking to become licensed. So a very good and positive thing there to be able to share with you guys about that. All right, so moving on to, we're gonna get into the meat of the program a little bit here and some key factors that we want you to be aware of as you consider this particular program. One thing that is important to just be aware of is, what is clinical psychology? It seems like a really simple question, and you might be thinking, well, of course I know what clinical psychology is, but because we're a vocationally based institution, we believe this is a call, we understand that not everyone comes into us with this rich background in psychology or undergrad majors in psychology or a lot of knowledge in psychology. And some of you, this may be even a secondary vocation for you, something, a second career, if you will. So one piece that I really like to encourage folks to do is get out there and do some internet research, talk to us, and really learn what it means to be a clinical psychologist, learn what clinical psychology is. And a lot of times when we're talking about clinical psychology, it is a little bit of a compare and contrast, like clinical psychology versus counseling or versus social work. So, what are those differences between those programs? And that is an important piece to understand. And it really is critical to you deciding whether or not this program is a fit for you. So this is actually in front of you, the definition of clinical psychology from APA. All right, so very simple, very straightforward. And it really, I think the key piece there is comprehensive mental and behavioral health care, consulting to agencies and communities, training, education, supervision, and research-based practice. So again, that's pretty meaty, but that is actually kind of a simplified version of clinical psychology. I'm going to continue to expound on that a little bit as we move through some of the slides. But as you are hearing this presentation and considering for yourself if this is the right program for you, I really hope that tonight you will be able to understand a little bit more about specifically what clinical psychology is, and again, a little bit in comparison to counseling, social work, and other kind of mental health related fields. All right, so I'm going to get a little bit into the program structure itself. So this is a very rigorous, fantastic program. It's going to be, something that's very rewarding but very intensive. I want to be very realistic about that. Our program is structured to have academic and clinical experience combined. It is a 5-year residential program. So I'm going to break that down a little bit and kind of explain what that means. So in that 5-year time period that you would potentially be a student with us, you would actually move to the Sterling, Virginia area. Sterling, Virginia is located outside of the greater Washington, D.C. area. We're near Dulles Airport. If you've ever, I think that's kind of a big spot on the map if you're looking at us. We're not too far from Dulles International Airport. So we are considered a suburb of D.C. Now, we'll talk about COVID too in a second, but I'm going to talk about the program for a minute. But as of right now, again, APA does ask that that any APA accredited Psy.D program be taught in person. That's a pretty big component of APA's accreditation. They really value the in-person learning, and again, it comes down to clinical skills, right? Everyone here can probably relate to that. You're talking, doctoral level clinical skills. They just really value the in-person experience and what that obviously brings to mastering your clinical skill set. So within that 5 years, that is a 122 credit hour program, and it is inclusive of both the MS in psychology and Psy.D degrees. Now, I do want to make a quick little notation. The MS that you're earning in the Psy.D program along the way is completely different than the MS program, that online independent program that we offer in the School of Counseling. So the one I mentioned earlier that's online, that is not the same master's that you're earning here. I just want to make that differentiation, okay? Because some folks will ask about that. Can I do the online program first and then come in and do your Psy.D? No, this is actually one program. It's inclusive of the MS in clinical psychology, along with the Psy.D in clinical psychology, all within that 5-year time frame. So just to break that down to the next level, in year one, that's that whole first year that you're with us on campus in Sterling, Virginia. That's a complete coursework year. We do actually front load your coursework in the program. And what you'll find is that each year that you're in the program, you're gonna have less coursework and more clinical and externship experience. And that's very intentional. Obviously, up front, we want you to have all of the academic knowledge that you need so that when you're going to be an extern and working in externship sites and seeing clients, that you have that skill set, that academic knowledge in place. So that's why you're gonna see your coursework front loaded. So your first year is entirely coursework. In your second year, you do continue coursework in the program, and we actually begin your clinical training. You have a boot camp in the summer. That's an intensive skills training session that happens in your summer between your first and second year. And then in your second year, you're going to have an externship site that's actually going to be DMU's clinic that's located in Sterling. It's actually in our campus building, and it's called the IPS Center for Psychological Services. And that will be your first externship experience. So you're going to be trained by our faculty and our clinicians, and your first externship experience is going to be, if you will, in our house, under our roof, supervised by our faculty and clinicians there. Then in your third year, you're going to again see a significantly reduced load of coursework, and you're going to see an increase in externship hours. And in your third year, we actually, then you're prepared to kind of send you out. So you will actually take on an externship in the local area. We actually have a list, you apply to them, you're selected, and so forth to that externship site. And again, that can be anywhere in kind of the Northern Virginia, DC area. And the locations do vary, the types of The types of externships can vary, and we can talk a little more about that if you guys have questions, but that is a pretty dynamic experience in the 3rd year. In the 4th year, that same experience continues, meaning externship work. You would most likely be at a different externship site in your 4th year than in your 3rd year, again, to diversify your experiences. And your coursework by your 4th year is very nominal and largely completed. And then in your 5th year, it's a big year in your 5th year. Your 5th year is your pre-doc internship, and ideally by your 5th year, you are finishing your dissertation and you've defended your dissertation in that 5th year. The pre-doc internship year, year 5, changes things up a little bit. You are actually at that point engaged in an internship that could be anywhere in the United States. You actually compete against other Psy.D students from all across the nation for these pre-approved internship sites where you're getting fully supervised, and you're really functioning as a doctoral level practitioner then, again, under supervision. It's kind of like residency for medical students. That's how that's a comparison I think that relates for a lot of folks. So that's in that 5th year. So in your 5th year, you could be really anywhere. It's not a surprise though, in the sense that you apply to different sites, and they can be, again, in all different kinds of areas, but you may not know the exact one that you will be selected for, but you'll know based on what you applied for. So for example, if you didn't apply to any internships in Alaska, let's say, you're not going to end up in Alaska. So if that makes sense. So that's the 5th year there. And throughout the entire 4 years and into the 5th year of the program, you are working on your doctoral dissertation the entire time. We actually begin conceptualizing that as early as the beginning of year 1. So really, all 4 years, you're engaging in that dissertation topic that you select, which is also really exciting for you as a student because it's going to be kind of your area of focus and research. So, and down there, you can see on the slide, I did include a few example sites, just a few of where we've had our where students will get their internships in that 5th year. And again, if you guys have questions, I'm moving through some of this pretty quickly. If you have questions, you can put those in the chat, and we can definitely make sure that we get to those here shortly.
Okay, and we actually do have a ton of questions.
Okay. Maybe we'll take a little moment here and pause this.
And I just realized that something happened with the screen, so I'm gonna restart the presentation. So the first question that we have is, are some of the credits transferable from another university if you were to come in? So of these 122 credit hours?
That's a great question. In short, yes, some of them are. And what I've found, and again, I've been doing this for a little while, but there's always, I find that there's an exception to every rule. In general, what I want to share is that if you have a master's in psychology, clinical psychology, or counseling, whole masters don't transfer into pretty much any program. All of these kinds of programs, they want you to have their full education. And there's a reason for that. It's because you're really getting that institution's education, their mission, their vision, their training skill set, their specialties. And that's exactly the case with DMU, is we really want you to have the bulk of education from us. So we do allow some limited transfers, and it's up to about 18 credit hours. And they do need to be qualifying credits. They would be reviewed by the registrar and the dean of the program to make sure that they are congruent with the classes that we're offering. So for example, if you took research methods at another institution at the graduate level, you could ask for that to be brought in and transferred in to replace our requirement for research methods. We would ask you for a course description and potentially a syllabi. That would be reviewed to make sure they're equivalent. If they're equivalent, then we would allow you to transfer that in. And again, the accreditation also needs to be in place, needs to be from an institution that's accredited, of course. So provided that all matches up, then yes, you could bring in, like, for example, that particular class. That's just an example, by the way, to demonstrate how that process would work. But in short, yes, you can do that. And the limit is about 18 credit hours, okay? So a couple semesters, maybe a large semester of work could transfer in.
All right, and another question that follows up with that is, how many students are admitted each year?
That's a great question too. So I'll take a moment and touch upon that and our admissions rate. So we actually have 20 available spots in the cohort. So our cohort will never be more than 20. We don't always start 20. We actually really, to tell you the truth, we look at qualified students, and we actually are selective. We're pretty selective. So we won't ever go over 20. So we typically fill around 12 to 15. That's kind of our range of what we start. We really are looking for the right student. It's really important to us at DMU. We know this is, we know the program well. We know it's a big commitment. And we really want folks that are really prepared for that kind of a commitment to that program. So it's going to be anywhere between 12 to 15, maybe actually seated with a maximum of 20. So I hope that answers your question. It's about the number in the cohort. So pretty small. You really do get to know each other. I know there's probably a question about admission rate. So the admission rate, of course, fluctuates a little bit every year. Once, for those that apply and who are invited to interview, and I'll cover that in a little bit too, our admission rate is about 45 to 50%. So about 48% this past year, that 48% of the people that interviewed were admitted to the program. So around half, you can say roughly half as an easy target. About half of those that interview are offered admission, okay? And if you want some follow-up on that, just let me know. That's a little bit on the admission rate there.
All right, I see we have a ton of questions coming through. We'll take one more question and then we'll move on to the next slide, but we'll be sure to answer them as we go along because actually some of them will be addressed a little later. The next question we'll take on now is, can you overview some of the current research areas by students and faculty?
Yeah, I can do a quick little review of that. So it's actually, this also brings me to, I'm going to go ahead and discuss a little bit about Psy.D versus PhD. One of the big things to understand about the Psy.D program, Psy.Ds are, the Psy.D is a practitioner-based degree. So anyone who has a Psy.D, they are going to be a practitioner versus a database researcher, okay? So this is how we kind of, in a nutshell, how we describe it is PhD, PhD doctorates in psychology produce research. Psy.D doctors use and implement that research. So that's a very important distinction. If you are if you're a qualified applicant for this program, you are someone who wants to work one-on-one with people as a therapist. You want to be journeying with people on their path to wellness, on their path to flourishing. You are interested and really desire to engage psychological testing and psychological assessment and so forth. So when it comes to research, we are not as Psy.Ds the producers of large research. Rather, again, that we are the ones who implement research and maybe even question, combine research methods, things like that of what existing research is already present, okay? So to kind of answer your question more directly, our faculty have had a number of areas where they have invested interest, have done research, have maybe produced articles. We have one of our psychologist professors is an expert in child play therapy. We have an alumni who also teaches at the institution and helps out. She actually specializes in trauma. We have individuals who've done addiction and have all kinds of addiction. Addiction, obviously, there's multiple kinds of addiction. So addiction has many categories in and of itself. We've also had, just by the nature of our institution being Catholic, rooted in Catholic Christian anthropology, we've had a lot of dissertations that come out that look at that anthropological perspective combined with, perhaps, different disorders or different addictions and things like that. At this point, what I would like to encourage you to do is to go to our website, and we actually have all dissertations listed. So I do want to encourage you to do that. Whenever you're looking at any program, all of you, I would invite you to take very seriously the work of the faculty and the work of the graduates. So on our website, you can go and look up, under academic programs, you can go to Psy.D. We have all of our faculty listed there. We have all of their bios and the kinds of research that they're doing and have done, their areas of interest and extra training. We also have every dissertation listed. And to tell you very honestly, from my perspective, it's incredibly diverse. It's very hard to actually capture here in a few sentences or a few paragraphs. there's a lot of interest that has been put forth in the research that we've done and the dissertations our students have put out. So I really do take that seriously. Go check that out. And maybe that's even something, Ebony, you and I can follow up with, is sending out a link to the dissertation pages so you guys can check that out. We can definitely do that for you too, because I really want you guys to see all the possibilities that you have in selecting your dissertation.
Yeah, and I actually just put that link in the chat. So if you all want to copy and paste that into your own notes, you can take that. So we're going to move on to the next slide and continue to submit your questions.
Wonderful. So I covered a couple of these things, but just briefly, I definitely want to capture on, intriguing your conscience, and really getting you to think about if this program is right for you. A couple of the fundamental pieces are, first of all, do you want to help people flourish? Are you interested in the science behind human behavior? Do you want to work with people that sounds kind of maybe silly to assume, but if you're a PhD psychology grad student, you're not always, actually encountering people or training to be a clinician, you're training to do research. So it is important, there is a distinction there, because there is another path here that you could, study psychology, but not necessarily work at becoming a therapist. So it's very important to note, are you invested in the human person? Do you want to become an instrument of healing and journey with people, along that path through the study of the psychological sciences? Are you interested in performing psychological tests, assessments, doing personal and clinical interviewing to make diagnosis and create treatment plans? That point right there, everyone, is really, really key to understanding clinical psychology. As clinical psychology, we do have that added ability in clinical psychology to conduct the whole battery of psychological testing, assessment, make diagnosis, clinical personal interviews, and so forth, which is not quite present in the same way through master's level programs like counseling and social work, for example. So just again, making that differentiation for you all there to take note of. And ultimately, are you looking to start a career, a vocational career as a licensed mental health professional, specifically a clinical psychologist? So just a few points there for you guys to think about and to see if those things fit what you're looking for. So next, what I'm going to do is I'm going to talk through 6 key areas of competency achieved through our program. Now, there's the 6 here that are listed in front of us, and we're going to, over the next 3 slides, we're going to break those down 2 at a time and kind of talk about each of those key areas of competency. So what this is meant to do for you as a prospective student is meant to share with you very specifically to say, these are 6 of, we've taken our whole program, we've kind of broken it down in these 6 key areas. And in each area, we're going to be discussing what you're trying to achieve in that area. So these next few slides are a little bulky, they're a little wordy, but I definitely want you to know about these things and to be aware of this is really what we're offering you academically. The areas that we're saying, hey, when you come out of our program, this is what you're going to be competent in at minimum. I mean, it's actually beyond this, but this is the minimum of what we're expecting you to learn and to be competent in as a result of our program. So what I'm going to go ahead and do, you can see them right there in front of us. I'm actually just going to go ahead and have Ebony move on to the next slide, and we'll just dig right into the first 2, okay? So the first one is foundations in psychological sciences and research. So graduates will attain foundational psychological sciences, you will obtain foundational psychological knowledge of the biological, cognitive, affective, social, and developmental aspects of the human person, as well as history and systems, psychological measurement, research, design, and statistical methods. Now, right there, those are actually not quite perfect, but those are basically classes. Like I just named for you right there. They are key areas, but they are their own classes. Like you will take a class called history and systems. You will have a class called psychological methods, measurement, and statistical methods, and research design. These are actual classes that you will take. So right there, that's all meant to give you just that foundation in the psychological science and specifically research. So while, again, we don't actually create the raw research like in a lab setting, research is absolutely fundamental to what we do in the program and training you to become a clinical psychologist, okay? And it does give you that ability to conduct your own psychological research. Again, it wouldn't be as large scale as perhaps a large research university, but you can certainly conduct your own research on a smaller scale and with support. You know, and again, that is done a lot in the dissertation process, okay? The second key area here is integrity in practice, a big one, especially given our mission. Graduates will be knowledgeable in the areas of diversity and ethics, display critical thinking, self-aware and reflective practice, and self-care. And graduates will demonstrate a responsiveness to supervision, collegiality, and professional cohortment in professional practice, okay? Those are really, again, a big one about integrity. So that's gonna go with, you know, learning ethics, learning sort of the, if you will, the bylaws of how you practice clinical psychology, knowing what your boundaries are, and really learning how to work within your scope of practice. That's actually another big one you'll hear more about. And also the other thing that's important, the students kind of talk about it a lot when they get into the program is self-care, that they say they hear self-care all the time. But the more that they're in the program, that they understand that self-care doesn't just mean, okay, I need to like take a break and, you know, go on a walk. It actually means knowing yourself and knowing the things that you can and can't take on. And I think if you can imagine in clinical psychology and the kinds of things that you would encounter as a clinical psychologist, it's actually very, very critical that you know yourself, that you really dig deep into your own self-work, that you work on the self so that you are able to become a really effective psychologist by not just helping people, but also knowing your boundaries, knowing yourself, and knowing kind of, you know, what you can take on, and also, again, working through your own, you know, your own background through therapy yourself. That's a big part of having good integrity. Is we don't, as potential psychologists, we definitely want to be, you know, we want to experience what our clients are experiencing. So therapy is actually also a part of our program that is highly, highly encouraged and frankly expected. So all that goes into building integrity for you as a clinician in practice. All right, so the next two areas that we're going to discuss are assessment and diagnosis, and then therapeutic intervention. Two big ones. If you remember, if you go back to early in the presentation, I talked specifically about how assessment was a major key area that differentiates clinical psychology from other areas of mental health practice. And therapeutic intervention is right along with that, because through the assessment and diagnosis, you are then determining appropriate therapeutic interventions for your clients. So these go hand in hand. So graduates will be able to conduct clinical interviewing, perform intake evaluations, demonstrate knowledge in the administration, scoring, and interpretation of psychological assessments. They'll be able to integrate multiple sources of test data and clinical interview information into a written report. And then again, of course, leading to diagnosis and the development of a treatment plan. So this right here, assessment and diagnosis, I do want to share, this is really a big area of the program. It's actually pretty complex. Students can struggle in this area. This is one of those areas that your science brain really comes out, you know, your math brain really comes out, your ability to write well really has to be you know, strong in order to create these professional written reports. So there's a lot here. So these two bullets to me are like the big pieces that make us, first of all, they're big in our program, but they make us different in clinical psychology. So do take careful note of these bullets and see if these are things that you're interested in, okay? If you like what you're reading, if it sounds interesting to you, that's a good sign, okay? The next one here, therapeutic intervention, number 4, graduates will be able to demonstrate case conceptualization, treatment planning, building and maintaining therapeutic relationships, psychotherapy skills, crisis management of urgent and special circumstances, and discharge planning. Again, sounds maybe kind of simple on the top, but it's actually very, very important to have that. That takes a lot of organization, you know, a lot of, you know, knowledge in how to, you know, create those kind of therapeutic interventions, and really to be able to think on your feet in those crisis situations, which really does just mean that you have to absorb well that academic content and really take to heart that clinical training that you're receiving, so that when these situations come up, you really are able to practice, you know, your best skill set and put that forth when dealing with your clients. All right, so our last two here are professional roles and clinical practice from a Catholic integrative perspective, all right? So clinical roles is graduates will be able to function in a variety of required roles of professional psychologists to include consultant, educator, supervisor, practice manager, and program evaluator. They'll be able to work collaboratively within interdisciplinary teams and with clients. So that one is, again, goes into the professional role of what you can be as a clinical psychologist. I actually like this bullet a lot because I think it points out, again, as a clinical psychologist, you are a consultant. You can be an educator. An educator means a lot. You're an educator to your client. You're an educator to as you grow in your profession, to anyone that you're supervising. You can be an educator in the fact that you could be teaching. You also, we don't really talk about this as much, but even a community facilitator. More and more today, psychologists are being called on to give presentations in their community, in churches, in schools, to really act as a first level resource, sharing with presentations with parents on looking for depression in teens, things like that. This is a really big part of being a professional psychologist, is being prepared to take that on and to present yourself well professionally. Point number 6, and our final point, and again, final but very, very big, is clinical practice from the Catholic integrative perspective. And graduates will have developed a Catholic Christian understanding of human flourishing and the individual person in marriage and family life, and be able to integrate this with the psychological sciences and clinical practice. Again, 6 here is what I would say is really key to understanding who we are as a university in teaching you the education of clinical psychology. The big thing that I want you to take away when it comes to this particular point is that, and to integration as a whole, is that integration is intended to change you as the psychologist. It's not something where you are, trying to change your client in the sense of making them Christian or making them like, it's you. You are the one who is wholeheartedly transformed through understanding more deeply what it means to be human, and to embracing the idea that each person is created with inherent dignity, with an inherent integrity, and that a person is not a problem, and a person is not their set of problems that they're bringing forth, perhaps in the clinical setting, that you're treating a person who was created by God whole and created by God as flourishing. And your goal is to help get them back to that, and to work with whatever is happening in their life right now and why they may be seeing you. So this is the big piece that really makes us different as an IPS DMU clinical psychology graduate, for you potential students that actually come in and decide to study with us, is that you walk away with you are the one that's changed. So that's, I think, a really important point. I'm happy to answer more questions on that and to share more on that. But that's really what we mean by integration, is we're bringing together those things. We're educating you so that your approach is fundamentally different and unique from other colleagues in the field that don't have this particular education. So those are our areas of competency that we are looking for you to achieve through our program. So if you have questions about that, pop in the chat. We'll try to address them.
Oh yeah, we actually got a question earlier that kind of touched on this. And considering that everyone may not have seen that question, the question was, are our faculty required to do research for grant funding? And the answer to that question that I put was that it's highly encouraged. It's a part of their faculty duties. So we actually had 3 faculty members who brought in $30K earlier this year for the publication of a book that won an award from the Vatican. So this integrative research is really important to our faculty members, and they have a textbook now that you would learn from that brings all of this material together. So it's not a textbook that every university has just yet, but we are getting requests and purchases so that they can have this the number 6, clinical practice from a Catholic integrative perspective. So, and we also have a department of the integrative studies, which is not something that other universities have. So I just wanted to point that out. That was a question that came a little earlier, so I wanted to share that.
No, that's great. I'm glad that you touched upon that. And I did want to quickly share with you, and again, I don't know how helpful this is, but at DMU, I think one of the other things that is important to share with you that upon the founding of the university, the founding faculty wanted a program that was specifically dedicated to the formation of practitioners, and that actually was practitioner student centered as opposed to faculty research centered. So and that can be difficult to understand. Like, we still encourage highly, as Ebony mentioned, the research, we encourage publishing. What we don't do is make it a publish or perish type of institution, because what we want to do is we want those faculty working with you as a student. We want them invested in your success. And so when you get too much into the publish or perish perspective, that can actually, the balance can swing away from the education of the student becoming fully engaged in their graduate program, and go more toward the faculty's initiative at hand. Again, there's still a lot of good in that. I'm not here to debate publish or perish perspective.
Well, and not to say, like, we have our newsletter, and our faculty are always, they're a little overly ambitious.
Yeah.
So even though it's not a requirement, they're always publishing things, and you could even reach out to our librarian if you wanted to see what those publications were.
Yeah.
Google,
I think it's important to understand that if you're a faculty member at DMU, you want to achieve. Like, you want to teach, you want to form people, you want to give the best education out there. And I really can say that we have top-notch faculty. So these faculty, they have a really, they have very well-developed consciences about this, I believe, is they want to be giving you the best training, and they know that they can't do that if they're not still pursuing their passions. And the other thing is they still have those passions that they want to pursue, so they still see clients, they still do research, they still write. So there's a lot on their plates. And so I think the takeaway there is that the student really is at the center of our educational style, and our faculty are keenly aware of that, and also very motivated to give you the best, the best in attention and best in care, but also the best of themselves, which means that they continually invest in research and writing. Okay, I'm not going to spend a lot of time on this slide because I am trying to pay attention to our time. These are just, you can read through these. These are just some areas or tracks that you could look at as becoming, when you become a clinical psychologist. So just to be very clear, the goal of this program is that you come through the program and we prepare you for the licensure process. Licensure, we'll touch upon that later, but that is a student-driven process rather. We prepare you for it, we talk about it, you're educated about it through the university system, but ultimately that is a process that begins after graduation. That's not a DMU thing. Once you're licensed as a clinical psychologist, a professional psychologist, there are so many tracks that you can look at, and you can read these here in front of you. You can open your own clinic, you can be a clinic director, you can be a psychiatric technician, you can be somebody who works in a hospital, you can specialize in different kinds of, different areas of aiding folks, whether it's trauma, addiction, substance abuse, so forth. There's it really is a huge pool of opportunities for you. One thing I tell folks, go check out, Indeed.com, those kind of job boards, and look at clinical psychologists. And once you start seeing what comes up, that will also give you even more insight into the kinds of different jobs that you can have as a clinical psychologist. All right, so here I just wanted to take a moment and let you guys read through these. These are just a few of our students. We do like to share. I mean, who doesn't want to share, happy students that are happy with their education. So here are just a few of those. And actually, I'm really privileged to know personally, we get to know each other here at DMU too. So if you guys come here, I'm going to get to know you. So will Ebony. It's kind of great. So all four of these students we know personally. I was actually excited today because I knew I'd be coming here tonight talking to you. And I happened to walk into DMU this morning alongside Kristen Long. And I first met Kristen Long a number of years back at a Focus SLS conference. So any of you who know Fellowship of Catholic University Students. And I'm really pleased to say her first encounter with us was at that conference. And I remember the day I met her, I remember talking with her, and I remember thinking like, okay, this is going to be really interesting. Like, this girl has a lot to bring to the table. Like, I really want her to come to DMU. And I continued to work with her throughout the process. And I've been able to keep in touch with her to this day. She's now a 4th year. And, we were just chatting this morning, and just, again, it's fun to be able to walk alongside her, see how the program is going. And she just said to me, she's like, Tammy, I'm just happy. I just love it. And I said, still loving it. You're good. 4th year, you got that good energy, because 4th year, you're almost done, right? You kind of get tired. She's like, nope, I love it. Best decision of my life. Love the people. She's like, I'm totally on board with this place. And she was just sharing with me about her progress in applying to her 5th year pre-doc internship. That actually starts a year in advance. So she's working on that right now. And she was just sharing with me a little bit about that. So I'm giving a little shout out to Kristen there, but it was just really such a joy to be able to talk with her about just how excited she is, and that she really can't wait to be done. And not in the sense of course, school's over, but wait to be done just because she really wants to get out there and get going as a clinical psychologist. So I was pretty excited to have that encounter with her by the grace of God this morning. It was fun to catch up a little bit. So she's getting more.
And I think it's really neat. One thing that sometimes people do not think of is that we actually have student assistants as a part of an intern, student assistance for federal aid. So if you go through the financial aid process, which we would highly encourage you to do, you could end up working directly under Tammy and assisting her here in the campus office. And I've been able to meet all of them on different occasions. I know that Kristen Long, she was with the reserves, and and we was able to talk to her about her experience and how she changed her desire to become a military psychologist into something else. Right now, she's still figuring that part out. And I've seen Timothy White sit alongside of me, across from me in a cubicle. So that was really interesting. And I know that James and Kirsten are very nice people. A lot of our students are very friendly and willing to share their experiences with you. So if you see a name, you probably will see them around here if you're admitted.
And I did want to just really quick touch on, if you see in James's photo, you're fine. I just want what James is pointing to in his photo there. He's the first one. He's actually, we do in the 2nd year of the program. Well, we do it every year, but we actually have a series where our students present like basically a conceptualized poster on their dissertation topic. They do a formal presentation, the whole thing, and you can see James is pointing to his, but there's another one behind him. And that's also, so your dissertation is not like in a bubble. It's not just you like walking through it on your own with, maybe a chair and a few committee members. Like, it's something that institutionally you're showcasing, you're talking to each other, your peers, you're bouncing ideas off of each other. And this is actually what James is in front of, it's his presentation where he's presenting on his dissertation concept. And it's actually neat because you get feedback on that. And a lot of the students, it's really helpful to them to see how they can build it up further, how they can hone in better on their idea. So our model is just very collaborative. And again, remember that when you're doing that, you're not just putting your information forward, you're also taking in everyone else's. So it becomes another layer of your education in hearing about what your peers are doing in their dissertation work. So I just wanted to touch on that a little bit. Hopefully that'll help you guys out and just knowing a little bit more about the program.
All right, and while we're on this slide, I thought it would make sense to answer 2 questions here. How many hours do you think a Psy.D student will be on site on a daily basis? And what type of schedule does a student have on a weekly basis?
That's a great question. So that what I'm going to have you do, Ebony, I'm going to have you go ahead and go to the next slide while I cover this one, and you guys can look at the next slide too while I talk a little bit about that. So it is important to note this 5-year program is full-time. Okay, it's full-time. You're not able to work when you're in the program. You're fully devoted to your academic studies. And actually 5 years for this master's doctorate is actually a little bit, it's actually considered accelerated, okay? So you guys are busy, all right? Just want to be pretty open about that. And again, if you remember back before when I said that your coursework was front loaded compared to your externship work, so you will have more time on campus in the first couple of years of the program compared to the last couple. So the most time on the campus is in the first and then in the second year. And then each year after that becomes less and then less. And then until your fifth year, you're not on campus at all because you're off who knows where doing your fantastic pre-doc internship. So the schedule is largely Monday through Friday for coursework. Monday through Thursday. Friday is a clinic day. Friday is a day when your faculty members are oftentimes seeing clients, so we actually don't have classes on Fridays. It's not traditional for us to have classes on Fridays. And that does give you a 3-day work weekend to work on your homework and to take care of your academic business, if you will, during those 3 days. So Monday through Friday, pretty normal business hours, I would say, 8, 9 until, somewhere in the late afternoon, potentially. It does fluctuate. I don't want to give the impression that you're in class like 45 hours a week, because that isn't quite how it works. It does depend on the schedule. But in general, students are on campus in those first couple of years, 4 days a week for the majority of the day. The time between classes, they may have a 2-hour break. A lot of them would be studying and doing work during those break times in the library or somewhere else on the campus. And again, each year becomes less and less on campus and then refocuses to you becoming almost like a working professional where you have a job but your job is your externship, okay? I can expound on that more later, but I'm trying to be a little conscientious of time here. Right here, I wanted to, as I mentioned before about researching dissertation topics, I do want to encourage you all to research the faculty. We are so fortunate. Here in front of you are just 6 of our faculty members here, and they're all phenomenal. They have amazing backgrounds, and you can see here, I'm hoping you guys are taking a look at the slide and you can see it well, and we have a little bit of their specialization up here. You will notice that Dr. Titus, he's the bottom middle, and Dr. Paul Vitz, he's the bottom far right, the last one. Those 2 are actually not practitioners. They're actually more into our integration. So Dr. Titus is our in-resident philosopher and theologian, and obviously a major mind behind our Catholic Christian meta model of the human person. And Dr. Vitz is an amazing story. If you guys don't know about Dr. Vitz, I highly recommend that you look him up. He actually is a PhD in psychology, and he does more of the philosophy of psychology rather than the practitioner side. So he is on the integration side of the house. So do want to encourage you to get to know those faculty. We have phenomenal, renowned, just really stellar faculty that have great achievements in their background. So we're very proud of that, and I want to encourage you all to look at them. And I'm sad that I'm not able to share with you more on each of them, because they really are wonderful people.
And you may have already read this off, but did you mention the specializations here under each?
I didn't, because I'm trying to save for time. I'm taking a sorry, Ebony. I know folks have, it's 8 o'clock, we said an hour, so I'm trying to, and again, everyone here, I'm trying to get a lot in this. It's a big program. It's a big part of your life.
It is. Well, I did want to just mention when everyone is able to watch the recording, to pay attention to these specializations, because I did get a few questions asking, can you focus on a certain population, those that are disabled, addictions, trauma, marriage, family, adolescence, and this kind of runs the gamut, and in addition to our other faculty members. So I did want to just make sure everyone was aware of that.
Yeah, and if you can go ahead and go to the next slide too, and I'll fill in a little bit on that one as well. You actually can do informal specializations, but you do it through your coursework. So if you have an area of interest and you have an assignment, you would actually just take your area of an interest and apply it to your assignments. And that's a way to build a little bit of an informal specialization. And then after graduation is when you could actually do formal specializations, okay? And that's something, again, you would learn about more in the program. Licensing, I did touch upon that earlier. I do want to zip through this slide, kind of quickly. I just want to share that licensing is required to become a practitioner, in the mental health fields professionally. You can't call yourself a psychologist with, practicing psychologist without licensing. It is a student-driven process, as I mentioned earlier. So it is something that begins after graduation. We do inform you about that. You're not going to be in the dark on it. We'll talk to you about how that works. And it is something that starts again after graduation. Takes about a year to year and a half. If you're working full-time, you are needing to build up clinical hours enough to actually become licensed. Your license, a lot of folks will ask, if I have licensure in one state, can I work in another? That is on state to state basis, if that's permissible. But once you are licensed, what we find is once you're licensed in a state and you maintain that licensure, reciprocity is actually not terribly difficult to achieve. So, you can work in Virginia, and then you can also, not a lot of effort, you can license in Maryland too, like their neighboring states. That's pretty common. And that's applicable through a lot of the states in the United States. So being able to work in a couple different states is definitely very possible. Just to answer that question, we get that one a lot. All right, I think we'll go ahead and move forward to the next slide. So I do want to talk a little bit about finances and investing in your education. So that's the next series of slides will be on that. We recognize that investing in your education is a very big deal. I really want to bring forward and challenge those of you here to think of this as an investment in yourself, an investment in education, an investment in your whole life. One of the things that I don't know that we all think about a lot is a lot of us will go buy a car. Some of us will buy a new car. Some of us buy, used, whatever. But a car, the second you drive it off the lot, it does nothing but depreciate. It does provide you a service, but it doesn't hold its value for you. Education is the exact opposite of that. It's an investment in yourself. And from the minute that you begin investing, that value only continues to go up. And not only that, is it lasts your whole working lifetime. Further, I did want to share with you guys, clinical psychologists have a history of working longer. And it's not necessarily because they have to, it's because they like to, and it's because they can. I know I've seen that at DMU. We have a number of professors who don't want to quit working. They love what they're doing. I mean, I think of Dr. Scrofani and Dr. Fitz as two of our, frequent flyers, if you will, in that category. Is they probably should retire.
Past retirement.
Yeah, their wives probably want them to retire, but they really love what they do and they're happy. And so that's one of the things that's noted about this field, is that your longevity, your ability to work longer is present. And a lot of that, again, comes from personal desire. So I do want to bring that in there as you're thinking about investing in this and investing in your future, just to consider those couple of factors as we move forward. Okay, so we did want to mention, or we did talk earlier about it being 122 credit hours. That's a big program. Again, please remember this is master's inclusive, okay? It's 5 years, master's inclusive. So it's 122 credits at a little over $1,000 a credit. So right there is about 126. I round up a little bit to give in for some fees. I like round numbers. I don't know if you guys do, but I kind of ballpark it at like 130. Just kind of sit there at 130 for everything for 5 years, for all of your tuition, okay, for 5 years. You do have to include your fees in there as well. That is over the 5-year period. How students will cover that is through a number of ways. We do have federal aid that's offered through the university through the federal student loan programs. We do have assistantships and federal work study programs where you can work for the university in exchange for a tuition reduction. We have a number of scholarships available to students. And then we do have a number of students who do alternative financing. And a lot of times what I find is it's students bringing all of these things together to create a financial aid package that works for them. But we do have students who will look at cash plans. They have private funds. We do have students as well who have maybe diocesan support and things like that. And we also do accept the GI Bill, by the way. I know that we have a veteran here, and so we do accept the GI Bill. And the GI Bill is independent. We have to actually look at your specific qualifications for your GI Bill, but it covers I think the majority of it. We've had students be really well served through the post 9/11 GI Bill. But we can look into that for you. You can also contact financial aid. We can do that together and get that the full information for you there on the post 9/11 GI Bill. Okay, I do want to take a moment and talk about scholarships that we have. We have a lot of different scholarships at DMU, and as a part of working through the admissions process, we do ask that you engage the financial aid process, filling out your FAFSA if you are a citizen of the United States or a permanent resident and you qualify for federal financial aid. We do require the FAFSA. We do also encourage you to apply for our scholarships. Each year we have a 50% scholarship that's available to one person in the cohort that is selected by the faculty. That is our largest scholarship. It's a really nice scholarship. We also from there have a couple of 25% scholarships as well that we do award. Similarly, it's awarded by the faculty. The average discount that our students would see on their tuition is anywhere between 15 and 30%. It just depends on your need and what you apply for. And these are just a sampling of the scholarships that we have available to you. I do want to encourage you to visit the scholarship webpage on our site and to see what scholarships interest you that you believe that you could qualify for. And I want to encourage you to apply for them. Apply for as many as you believe you're qualified for. We do allow an award of up to 3 different scholarships from our scholarship list. I'm going to switch for a moment to entrance requirements and talk a little bit about that process. We do ask that you have a baccalaureate from a regionally accredited or internationally recognized school. We do ask as well that you have a minimum GPA of a 3.0 on a 4.0 scale. If you are less than a 3.0, you could be considered for admission on a case-by-case basis. If you have graduate studies, we also ask that GPA from graduate studies be a 3.5, okay? Just those are a couple of the big ones that we wanna point out for entrance requirement purposes. So the application process, this is again all on our website, but essentially the first step here is you're going to be completing the online application that's on our website. You start there, but that is actually just one step in the process. Once you fill out the online application, we do ask that you submit all additional required documents like your GRE scores, your recommendation letters, official transcripts, and so forth. I do want to share that the GRE is required. I know we get that a lot. I know some institutions are waiving it. We actually find a lot of value in the GRE. It's a key instrument in our weighing of applicants. So I hope that that's not a discouragement for anyone here. I know it's never fun to take a standardized test, but I do want to share with you that GRE is still required. And positive thing though is with COVID, you can take it at home. For the first time ever, GRE has implemented a system where you can actually take it at home. So that's awesome. So we do require it, and it isn't something that we just ask for and don't pay attention to. I know somebody said that to me the other day, oh, that schools don't care. We care. We actually pay a lot of attention to the GRE. We do not have a minimum score that we require, but we do ask that you take it. It is to be submitted along with all of your other application documents at the time of application. Once we receive everything in our office, we're going to ask you to engage that financial aid process. We're going to be in communication with you. And those applicants who are qualified and competitive are invited to a required interview via Zoom. It's a Zoom group interview. Normally we do it in person on site. With COVID. As I mentioned earlier, we had some COVID practices in place. We are offering all of our interviews to be done over Zoom. You can still visit campus. We're still going to host some visit days that are socially distanced. We do encourage you to visit campus, especially if you're very serious about that program. But the interview phase will actually be done through Zoom this year. And again,
we have one question on that.
Sure.
About the percentage of applicants offered on-site interviews.
I did cover that earlier, and I shared that it's about half of those interviewed are offered admission, okay? And then kind of keeping going here on point number 5, you'll be notified of the admission decision not later than mid-February. And I'll go into that a little bit at the end too. That is the absolute latest you'd be notified. So I just wanted to share that. We actually have several points in which you would be notified earlier if you applied to those earlier admission dates. Our goal is to have folks apply to those earlier dates, to have an interview, and then to procure a decision fairly quickly after that. But again, the latest you would be notified would be mid-February, okay? Admitted applicants then accept their offer for admission, and they register for classes, and our program begins in August of 2021. So that's just a little synopsis there of the application process. All right, so how to complete your application. The application document online is 2 parts. The first one is a lot of biographical information, just things you'd be expected, you know, name, address, who your recommenders are, things like that, where you went to undergrad or maybe graduate school. That's all in part 1. And then in part 2, we do ask that you submit essays, and those are online. You can find those in the application, and your resume. We do ask for a professional resume as a part of the second part of the application. And it is a $55 fee to apply. We also ask for 3 recommendations, 2 of which must be academic in nature, and the 3rd can just be professional, somebody who's supervised you. We do have a recommendation form that we actually require you to use, and we do ask the recommenders also be open to sending us a personal letter of recommendation in addition to our form. We don't require that hard and fast, but we do definitely prefer that, and we ask them to submit that if they would be so generous as to do so, just to get more information about you and to get to know you better as an applicant. We also require official transcripts from all post-secondary institutions and your official GRE test score. And we put the DMU code there if you haven't taken the GRE. And it does need to be valid by having taken it within the last 5 years. That's the validity maximum for the GRE. If you are an international applicant, a couple things that we want to make you aware of. We would ask you that if you have attended an institution outside the United States, we would need a course-by-course evaluation. And we would also ask if English is your second language, we would expect that you would take the TOEFL or the IELTS test of English language proficiency. So just a note there for international applicants, and know that we're certainly happy to help you with that process if you do need some assistance with knowing what those things are, how to locate, a NACE's approved education eval service. So we've got all that available in the office. We're happy to help you out. Just let me know. As we kind of get near the end of the presentation, I did want to share some special notes about our deadlines. So we actually have application deadlines. We have 3 different deadlines. So we have upcoming with October 15th. We have a $4,000 scholarship, early admission scholarship, specifically for those who apply by October 15th. Again, do note that means you would have to have your GRE scores. All of that has to be in by the 15th and no later than that. If you are aiming for the deadline of October 15th, your interview date would be October 30th. So if you can see here on this slide, with each admission deadline, we have a corresponding interview date. We are giving that to you up front. We want you to reserve that date in advance in case, and hopefully so that you can be ready and prepared when we invite you, or if we invite you to interview. Again, we're hopeful that qualified applicants are invited to interview, okay? I just want to share that too. If you're qualified, your chances of being invited to interview are quite high, okay? The second early admission scholarship is December 31st. That's our big one. We do drop it down $500. It's just $3,500, but everything is due December 31st. Yes, we're going to check that. That deadline matters. I know folks think like, oh, it's a holiday the next day, but we will be checking that. That is a firm deadline. And your interview date would then be Friday, January 15th. We did want to give the Christmas break. I actually changed these deadlines up a little bit this year. I appreciate the value that some time off around Christmas can offer folks. So we've heard that in the past, that it's helpful to have time over Christmas to kind of maybe get some of these things, done when you have a little extra time after the holidays. So we do have that deadline there. The main deadline that I anticipate will get the bulk of applications is December 31st. And then our final application deadline is February 12th with an interview date of Friday, February 26th. So again, you as an applicant, you choose the deadline here that works best for you. You know where you're at in your confidence for interviewing, where you're at with your GRE and being able to gather recommendations and execute that part of the process. So we rely on you to decide which one of these deadlines work for you, okay? All right, so in closing, I really just want to share a big note of thanks with all of you here. You're hanging in there with me. We're a little over time here. I hope it's been worth it for you and that you've gained the information that you are looking for as you consider our program. I want to share that one thing that I really try to do is hold those personal meetings. I'm more than happy to talk with all of you one-on-one. I see some folks here who have taken advantage of that and have visited with me maybe once or even more than once. I want you to know that my goal is to help you discern if this is the right fit for you and to share with you accurately the information pertaining to this process and to make sure that you know how to, to move through the process. So my office, you kind of have an open door policy. you can contact me and set a meeting for any time. I've met with folks, even this year already, 2 or 3 meetings or more, just to make sure folks have the info that they need. So please don't hesitate to take me up on that. We will be following up with an email, and I'm really happy to answer questions and just to really walk with you as you discern if this is the right program for you. And I just want to close in sharing that I do know this is a big, big decision for you guys. It is not, I don't take lightly the weight of this. I know it's 5 years. I know it's potentially for most all of you a move to the greater Washington, D.C. area. It's a substantial commitment of time and energy and financial resources and personal resources. So that is not lost on me. So I just want you to know that I will have a very deep appreciation for what each of you are doing as you consider if this program is right for you. And I do want to ask you in return to really consider what kind of an institution you want to be a part of, not just for your graduate education, but to remember that this education follows you for your life. What I mean is the education is in the work, but the network that you build up, the kinds of colleagues that you could work with, who you would call when you have that really big case at the end of the day that you just need to process with somebody. This is your network for that. This is, so what you're getting here is not just an education that you can get anywhere. I mean, you're getting everything. You're getting a whole lifetime of support, of network, of colleagues that you can lean on, that, you may hire each other, you may, build a practice together. I mean, this is it. This is really so much more than just a 5-year education. It really is work for a lifetime and a network for a lifetime. So I just ask you to really consider that and to consider what that classroom experience as well might be like with our kind of mission and our kind of vision. So those are just some parting thoughts for you that I just ask you guys to consider as you think about DMU and if it's a fit for you, okay? If you have any more questions, what I'd like to do right now is I'd like to go ahead and close out the webinar officially, and I could hang around for about 5 to 6 more minutes and answer a few more questions. So if you have to go and hop off and take care of life and whatever that may be this evening, I want to certainly thank you again, and feel free to hop off. For those that want to stay on and ask a few questions, I'll sit here for a little longer and be glad to answer those questions for you, okay? So in closing, I want to thank you all for being here tonight, and I want to thank Ebony for her support in helping us with this presentation.
Yeah, thank you, Tammy. You did it like a champ, and I always like to remind everyone that this information, the contact information here is always a resource. Tammy is always on her phone. She's always emailing. She's responding as quick as possible. We get a lot of requests, so you have to be a little bit patient, but she's very responsive. She wants to be there for you. I would advise you to jot down this contact information now so that you can have it, even if you want to store it in your phone, that'll be good. She also has a Calendly link. Do you happen to know your Calendly link?
Yeah, I'll pop it into chat right now. I'll go grab it and pop it into chat.
And Calendly is just pretty much a way to schedule a time to speak with her about financial aid, the deadlines, things you may have concerns about as far as personal life, when you should start the program. Should it be 2021? Should it be 2022? And just making sure she can answer all of those questions that you may have specifically. And we will be sending out this recording after, not immediately after, but sometime this week. So make sure you check your email. All right, so we have a few questions that came in. We'll spend about 5 more minutes. So if you have something, feel free to put it in the chat.
I'll try to be quick so we get as many answered as possible.
All righty. So the first question we have here is, do you provide health insurance for students and their family?
It's a great question. So when we, I'm not sure exactly what you mean by provide, but we do have insurance options available for students to purchase on their own that could cover individuals or families. And what we actually do is we don't have a blanket plan. We actually have an agent who walks through, who basically works with you personally to find your budget, your plan, what works for you. So I actually like that. I've worked at institutions where we have a blanket policy, and it's just one size doesn't fit all. So at DMU, new this year is actually the ability to walk through finding a plan, a student plan for you and dependents that kind of fits your need.
All right. And I see two questions that can kind of be bubbled into one, which is regarding COVID. And I know that this is a very sensitive topic at times. How has our program been affected by COVID, and how are we
Yeah,
planning to?
I'm forgive me, you guys. I did mean to touch on this more in the presentation. There's a lot, and I'm trying to do my best to give you guys all the information possible at the same time, trying to do it quickly. So with COVID, we actually we are doing Zoom interviews, as I mentioned. When it comes to the classroom, we are offering in-class options, like actually in-person teaching option. You can attend in person. If you're not comfortable with that for any reason, you can actually opt out and you can do virtual classes. APA has made a provision for that this year. I don't know where that's going to lead APA. We're all kind of holding our breath. What's beautiful about DMU, about any of us in higher ed right now, is we really are following the directives of the accrediting bodies, of our state and our other, other directors from like other areas of authority, like SACS, for example, the Department of Higher Ed, for example. So for us, APA lifted their restriction on no online classes. And so we don't call it online, but it's called virtual. So you do join classes in real time remotely. So if your class is at 8 a.m. Eastern time, you're going to hop on Zoom and you're joining virtually on Zoom at 8 a.m. for that particular class. The beautiful thing about DMU having online programs is we actually were already really well set up with a platform to host this with high quality. So I can tell you with confidence that we are very prepared, and we're prepared to be able to move our program online. It was not easy, of course. It was a lot of challenges. We have faculty who if you think about some of the, our faculty have been there forever, they haven't really done a lot with online learning. So this was a learning curve for some of them. But again, because we already had other programs in place, we were able to pull from those resources to really get that department and those individuals, the whole university, just fully prepared for remote learning. So impact, I would say, is of course significant, but what in the sense of like what everyone here is dealing with, the university is dealing with, social distancing and masking and things like that, adjusting to more Zoom, less in person. We're making all those adjustments just like everyone else. What I think has not happened is we've not had a drop in our students. We haven't had a drop in applications. So really, we're really fortunate that all of our students, praise God, are still able to stay with us and are continuing forward in their education. We've been really fortunate with that.
All right, and a good follow-up to that is regarding the internships and how they have been affected by COVID. I believe some students are doing
Yes.
virtual therapy.
Virtual, yeah. So we are doing some additional training in virtual therapy, which is actually, I was just speaking with a student. I love my job because I get to know the students personally. But I was just speaking with a student in my office the other day, and we were talking about virtual therapy and really that institutions, I mean, not just DMU, but that wasn't necessarily a big part of your graduate school training was virtual therapy. It was something you went and got additional certifications in afterwards. And because again, not every state is even on board with virtual therapy. That's something to take note. So you didn't see that universally in graduate programs. And we were talking about the shift in training now to being so heavy with virtual training and just honestly what a good that is. So while it's down, that's a downside, just that you're not in person as much. The upside is really you're seeing a cultural shift to really valuing virtual therapy. And we are responding with that very quickly. And we're there. And that we're training our students and we're implementing virtual training for virtual therapy. And we're also training on what are the ramifications of that? What does that mean for therapeutic relationship? What does that mean when it comes to licensure and individual, municipalities on how they handle, virtual therapy? So there's a lot that goes into that. And that's just now part of what we're doing, just like everywhere else. So you are still doing externships and you're doing a lot more virtual therapy in those externships. But there was definitely a pause earlier in the spring as the whole nation and the whole world adjusted to the pandemic. But now we're on track with that, and we have great work going forward, and we're engaged fully in that.
All right. Another question we have regarding that October 15 deadline for the early admission and the December 31st deadline is, how long do you have to accept the offer for admission?
That's a really good question. We usually ask for something within a matter of weeks, but also we work with you. Like what we don't want you to do, and look, we do this every day. I know that a lot of you are looking at other institutions and you're waiting for other offers to come in. That's something that we just ask you to talk to us about. So, we definitely ask you to respond to our letter. So I don't necessarily say to confirm or accept. I ask for a response within about 4 weeks at the longest. And that response can be, okay, Tambi, I really need to see what comes in. I really need to talk about, my options. And that begins a discussion between you and I on what that looks like. And, and we do that every day. We know how this game works for you guys. You're really trying to figure out the right place, and you've got multiple offers coming in. So we definitely allow for that time, additional time if you need it.
All right, well, it looks like there's been a pause to the questions. Maybe some people are heading off to bed or eating dinner or whatnot. But we thank you for joining tonight's webinar. If you have any future questions, please feel free to reach out to us. And
I did see Ebony in the chat, like Diana, I don't know if you're still here, but like some of those questions that are more, I'm not trying to put you off at all tonight. I just want to be sensitive to that. Really, all of that we can talk about. You can just send an email to admissions.Psy.D@divinemercy.edu. I'll answer your questions. You can make an appointment to visit campus through me by emailing that address. I do ask for several days notice just so I can plan for that. And I'll be glad to talk with you about the GRE and all of that, even over email. So if you have anything else, don't hesitate to email us, and we'll definitely get back to you. All right, I think that's it, Ebony. Is that we're kind of at the end there with the questions?
I believe so. So thank you all again, and you'll be receiving this recording. You all have a blessed night, and we hope to see you at the interviews later. So go ahead and make sure you get that application in.
Exactly.
It's on our website.
Wonderful. Thank you all very much. Thank you. Thank you so much for your time, everyone.
Bye-bye.
Thank you, Ebony. Have a good night. Bye.